Welcome to Health Talk, brought to you by White Plains Hospital. We're on Westchester Talk Radio, and we're being produced by Shark Creative. Today, a very, very important topic with Dr. Boris Chupayev. He is the Chief of Neurology and Stroke Director at White Plains Hospital. We're discussing stroke and the signs and symptoms of it, something that I don't think we as just regular people can hear enough about, because apparently the likelihood of surviving a stroke is much greater when you catch it early, catch it fast, and take all the right steps. So we're going to talk about that. Thank you so much for joining us today. If you could just briefly explain, what is a stroke?
A stroke is a very, very important topic. As you know, it's number 5 cause of disability, number 3 cause of permanent neurological deficits for the rest of your life. Stroke is occlusion of a blood vessel in the brain or bleeding due to perforation of that blood vessel into the brain, where the blood flow ceases to perfuse a certain part of the brain. And you can have focal neurological symptoms such as losing of vision, losing function of the arm, the leg, inability to speak or concentrate. But we'll go over some signs and symptoms that people need to look out for. But again, I can't stress it enough how important stroke is. It affects close to 800,000 people in the United States year-round. And stroke occurs every 40 seconds every day.
Oh my goodness, that's really alarming. I'm thinking, if I am just in my house having a regular day and I'm starting to feel different things, can you maybe take me through what it would be that I would be feeling within myself that might tip it off that I might be having a stroke?
Strokes do not present with significant symptoms that you might notice, right? Like a heart attack, for example, where you have severe chest pain, you know something is wrong in your chest. Mm-hmm. Blood flow ceases to perfuse a certain part of the brain, we lose function, we lose sensation. So most of the time, we're not even aware we're having strokes, right? If you notice that your arm, your leg, or your face are droopy and you're unable to use them, or you feel dizzy, these are the primary signs and symptoms that one can look out for. If you start to slur your words is another one, or inability to see. A very good acronym for certain signs and symptoms that people need to watch out for is B FAST. B stands for balance and coordination. E stands for eyes, inability to see from one eye or both eyes. F stands for face, droopiness of the face. A stands for arm, as inability to raise your arms equally on both sides. S stands for speech, so slurring your words or inability to get your words out. And T, this is the most crucial one, it stands for time. The sooner you realize you have symptoms, the sooner you call 911 and can come to the hospital to receive a certain time-sensitive treatment for stroke called TPA, which is a clot-busting medication. They can reperfuse that blood vessel that's occluded by a blood clot. You can return back to your normal self.
Well, I understand, and this is wonderful for people in the Westchester County area, that White Plains Hospital has a special expertise in the area as a New York State designated stroke center. What does this actually mean for patients and the benefits of being designated that?
Very good question. So White Plains Hospital is the first and so far the only Joint Commission certified primary stroke center. It means we provide the highest level of stroke services. 24/7, we have an inpatient neurologist specialist in stroke, either in person or via telemedicine, identifying stroke signs and symptoms and giving patients this medication that I spoke about earlier in a timely fashion. Try to reperfuse the brain as soon as possible. But also, we refer certain patients that this medication doesn't work for or cannot receive this very strong clot-busting medication to our partnership in Montefiore to manually retract the clot out of the brain by using certain catheters.
Mm-hmm. Wow. It's comforting to know that we're fortunate to have White Plains Hospital here with that designation and expertise. And speaking of expertise, thank you very much for joining us today, Dr. Dr. Boris Trupayev, who is actually the Chief of Neurology and Stroke Director at White Plains Hospital. Such an important topic, and we're very grateful for it today. Thank you so much. And this has been Health Talk, brought to you by White Plains Hospital. You're listening to Westchester Talk Radio, produced by Shark Creative. Thank you. I'm Laura Smith.